So just like that, we are live with Mark Eichler. Mark, welcome to Covered, the podcast.
Thanks. Glad to be here.
Glad to have you. And for our listeners, they may recognize your voice from the introduction of Covered, the podcast. Now, tell this story. Have you done voice work before? We were getting started with this podcast, and the team here said, you need to have Mark do the introduction.
Yeah, I've done a little voice work. I've done a lot of radio ads over the years. When I first started my pharmacy career here in Helena, I actually did a lot of radio work, advertising the pharmacy. And so we kind of co-opted with the DARE program. I don't know if you remember.
Okay, yeah,
Drug
DARE,
Abuse
yep,
Resistance
absolutely.
Education program. And so we went to, every month we went to a different school, fifth grade class in the community, and did a commercial, all the kids and the teacher, and then I'd be there and we'd do a little spot on there about, please come to Gibson's Pharmacy, your family pharmacy, and that was a good way for us to advertise the pharmacy without advertising specific product, because you just can't do that really in pharmacy.
Sure.
Vitamins and different things, but it was a way for moms and dads and grandparents and aunts and uncles and cousins and friends to see their child on TV. So it was a great little advertising campaign for a community pharmacy at the time.
Yeah, very good.
And done some other things with radio ads and pharmacy over the years as well.
Cool.
Yeah.
And so pharmacy. So that's what we're here talking about today is prescription drugs. Pharmacy, people who have questions about their prescription drugs. Oftentimes that's one of the main questions when either switching healthcare plans, starting a health insurance plan. So for our listeners, can you introduce what your role is here at the co-op?
Certainly. By title, I guess I'm considered the pharmacy director for the Montana Health Co-op, which is included also the Idaho Co-op as well. So I'm responsible for all things pharmacy here under the insurance company, the co-op insurance company. So all the insurance or the prescription drug coverage benefits that we provide to our members, that's my responsibility to make sure that flows smoothly. It's a quality clinical product for our members, and that it also provides value to our members as well, so that they maintain healthy and happy lifestyles.
What are some of the frequently asked questions that new members have when it pertains to their prescription drugs?
Well, first of all, they just want to know whether the drugs that they're taking are covered. That's simply their first question is, why would I choose your insurance company versus some other ones? And generally, it's most all prescriptions are covered by an insurance company. It's just there are some medications that may be covered in a different tier or formulary tier, and that formulary tiers just tell you what if a member, what your responsibility is going to be for payment of that prescription. It could be a copay, $1 copay, or it could be a coinsurance amount, like 10-20%, or in some cases, if you're on a high deductible plan, you're going to pay 100% out of pocket until you meet your deductible.
Yeah.
And then after that, there'll be some kind of, it might be a no cost share after that, or a copay or a coinsurance after that as well.
Okay. Can we unpack some of that and talk about copay, what that means?
A copay is just simply what for example, if you walk into a pharmacy, you provide your insurance card to the pharmacist, or the technician there. They will plug all that information into their computer. That information will be sent to the pharmacy benefit manager for the insurance company, and then
in the case of the co-op, that would be yourself. That would be somebody else.
A company that currently it's our third-party administrator, is University of Utah Health Plan, and so that pharmacy claim, if you will, is transmitted electronically to the administrator, third-party administrator, or pharmacy benefit manager. And then that transmission comes back to the pharmacy and tells the pharmacy how much to charge you, our insured, what your cost share is going to be on that prescription. So
Okay.
that's how you know how much it's going to cost you. Might be 100% of a discounted price
Yep.
if you're on a high deductible plan, or it might be a copay, which could be, like I said before, a dollar amount or
Yeah.
a percentage amount of that prescription.
Okay.
And so that's what your financial responsibility is toward that
Yeah.
prescription.
And coinsurance. You mentioned coinsurance. How is that different than copay?
Coinsurance, it's just a percentage. So let's say that the total bill for the drug is $100.
Sure.
And you have a 20% coinsurance. Just means that you're going to pay $20 of that $100.
Okay.
Or if the drug is $500, you're going to pay $100 of that. Or
Sure.
if the drug is $10, you're going to pay $2 of that. So it's just a percentage
Okay.
basis calculation versus a fixed dollar. Sometimes copays, for example, if you have a $20 copay on a generic drug, well, the actual cost of that generic drug might be $5 or $4, and so you wouldn't pay the full $20. You would pay the lesser of whatever
Sure.
the actual price is of that medication.
So, what kind of advice would you have then for somebody who is wondering, how much does the health insurance cover my prescription drugs? As they're looking at these different tiers that certain health insurance plans offer. When you say tier, is that different levels of, hey, at this much per month we'll cover this much of your prescription drug costs. At this much per month premium we'll cover, this
It's
much.
a little more complicated than that, but
Okay.
because your premium covers hospital, physician,
Sure.
medical, and pharmacy.
There's a little more,
Right.
bundled in there.
So the tiers are simply like for us, for example, we have a 5-tier formulary. We have a tier 0, which means that drugs in tier 0 there's no cost share to you. So there might be a preventive medication list that we provide medications in that tier at no cost to our members. Tier 1 might be is typically a generic tier. So if you're on a generic medication, you would pay the corresponding copay or coinsurance for that tier. Tier 2 might be a preferred brand drug tier,
Okay.
and you'd pay the associated copay or coinsurance for that. And then tier 3 would be in maybe non-preferred brand drugs that don't really provide any more financial benefit or clinical benefit than a preferred brand does. They're just more costly to the plan, so they're non-preferred. And then tier 4 for most insurance companies, even including the co-op, is a list of medications called specialty medications, and they're generally higher cost medications that require lots of individual management of that. And so your costs for the specialty medications are going to be significantly more than they would for one of the other tiers. So those 4 or 5 tiers are just simply a stratification of the medications on the formulary, which is just a list of medications that are covered by our prescription drug plan.
Okay. So is it safe to say your choice for health insurance will be significantly steered by your current prescription drug regimen?
Well, perhaps,
Okay.
if depending on what medications you might be on.
Yeah.
Because one insurance company might have a particular brand at a preferred level, and another insurance company might have that same brand at a non-preferred level.
I see.
Depending on their contractual discounts with either manufacturers of the pharmacy benefit managers that they use to adjudicate those claims.
So making sure this insurance company, here's how much I would pay perhaps at this insurance company, here's how much I would pay at this insurance company.
Yeah, the best advice I could give to a prospective member or one of our members today is to ask us for a copy of that formulary so you know what medications are on the formulary and what tiers they reside in. Ask us those questions. You should ask because the pharmacist or pharmacy that you go to, they provide prescriptions to members that from maybe 10 to 100 different pharmacy benefit services.
Sure.
So they're not going to perhaps know exactly what the co-op's formulary looks like. So the member should just engage us and make us actually provide that information to you, answer your questions. Don't be shy about asking us for those answers and where your medications lie. There are other restrictions that might be placed upon those, like quantity level limits, and other utilization management edits that are part of that formulary list too. So that's the best advice I could say.
Yeah, no, that's great advice.
Ask the question.
Absolutely. I'm sure there are some listeners out there thinking, that's really refreshing to hear, that I can contact the co-op and get in touch with a real person that can give real, expert advice on, or at least expert analysis of here's what you would be paying. And the way I described it might sound sort of, Excel spreadsheety, like, oh, you have these plans and this is how you analyze it. But there's so much more when it comes to the co-op that is member focused and member centered.
Sure. We hope to develop more of a concierge system for our members, much like what we would call an Ask a Pharmacist. So you can dial us up or text us. For example, we're going to have the ability for our members to text us and ask questions about formulary coverage or just medication coverage in general, and we'll be able to have conversations with individual members about that. Perhaps give them advice on what kind of a conversation to have with their doctor about maybe cheaper medications that provide the same clinical benefit as maybe one of the drugs that they were on. So
that's amazing.
Just ways to be more personal.
Yep.
That's the co-op's mission. That's why we're here. We're about the member. We're member owned and driven. So we want to be all about the member. So
right, getting that information across in a personable way.
Exactly.
So many times I think people are on hold or talking to robots via chat on a website. And like, no, that's not what I meant. So this is really exciting to hear. Mark, I'm curious, just from a personal standpoint, what hobbies do you participate in? Or because we're in the co-op is Idaho and Montana, and we're here in the Rocky Mountain West. Do you take advantage of some of the stuff out here? And if so, what types of things do you enjoy?
Absolutely so. I grew up in South Dakota, but moved to Montana during my college years. So, and graduated from the University of Montana School of Pharmacy. So I just absolutely think if you live in Montana, you should avail yourself of everything Montana or Idaho, for that matter, has to offer. So I'm an outdoor guy. So I do everything we can almost do in Montana for all of the seasons, whether that's snow skiing or water skiing or hiking or mountain biking or just name it. I just love to be
You're in it, doing it.
In it, doing it. Yep.
Exciting stuff.
That's motion is lotion. That's how we keep healthy, and so we want our members healthy too. So I like that same mantra for everyone.
Yeah, that's great. Any questions that I didn't ask you that you were hoping we would cover today when it comes to prescription drugs and when it comes to members and managing pharmacies?
Well, I not really so much as the questions that I did not look forward to asking, but just some other suggestions for folks is, pharmacists are great resources. So yes, while we insure our members and we provide a pharmacy benefit, it's really important. I want to really stress that our relationship with our pharmacies that provide prescriptions, as well as those pharmacists and technicians in those stores, those are great resources too. They may not be intimately familiar with our formulary, but they know how to contact us. Plus, they're the respected and trusted source about medications as well. So I just want to put in a plug for our pharmacy partners as well. They just don't be afraid to ask them and engage them. Just like we want you to engage us here at the co-op about your prescription drug coverage. But if you also have good any kind of a question, you need to engage that pharmacist. Do not be afraid to ask them to come speak with you about your medications. Don't just go get a prescription and walk away from the store unanswered. Ask them.
That's really great advice.
Force them to do that.
I think there is some timidness happening when they get up to the counter and
I'll just take you might be in line,
right,
and there's lots of people there. Well, I'm sorry, that's not a good enough answer. If you have questions, you get them answered because that's their job to do that, and they should. So
yeah, no, great advice. Mark, thank you so much for being on this episode of Covered.
My pleasure.
I think it was a really quick hit on, hey, this is what people can think about when they're thinking about prescription drugs, and you unpacked some of the complicated terms that people hear. So thank you for doing that.
Yeah.